Hi dear students, now we are going to discuss about the concept of receptor. Okay, receptor. See, receptor nothing but it is a protein substance. It is a protein substance which can receive the signals. Hence we can call it receptors. Nothing but these are the protein substance which can receive the signals. So when it comes to the types of receptor, there is a various types of receptors will be there, that is G protein, ion channel, nuclear receptor, like that. So here we are going to discuss about some G protein coupled receptor, that is alpha receptor. Next one is beta receptor. Next histamine receptor. Okay, H1, H2 receptor, H3, H4 and H5 will be there. Next serotonin receptor, 5-HT2 receptor, that is serotonin receptor. So these are the few G protein coupled receptors. Now we are going to discuss about the alpha receptor here. See, the alpha receptor will be there. See, the alpha receptor, that can be two types. One is alpha 1 receptor, next one is alpha 2 receptor. See, alpha 1 receptor, it is located on the blood vessel. It is located on the blood vessels. It is located on blood vessel. See, if it is located on the peripheral blood vessel, if that alpha 1 receptor is located on peripheral blood vessel, so what will happen? If activation of alpha 1 receptor located on the peripheral blood vessel, so there is a chance of vasoconstriction. Vasoconstriction will be there. If there is a vasoconstriction will be there, automatically what will happen? There is a increased blood pressure. The blood pressure is about to get increased. If there is a increased blood pressure will be there, so the condition, okay, so this, especially this alpha 1 agonist can be used in the treatment of, this can be used in the treatment of shock, hypotension. See, if activation of alpha 1 receptor located on the peripheral blood vessel, so the effect is vasoconstriction will be there. If vasoconstriction will be there, what will happen? Increased blood pressure. Hence, the condition, that is hypotension along with shock, that can be treated. If the alpha 1 receptor that is located on, if the alpha 1 receptor that has been located on nasal blood vessel, if it is located on the nasal blood vessel, what will happen means vasoconstriction only, vasoconstriction, okay, vasoconstriction condition will be there. If vasoconstriction will be there, we can call it it can decrease the nasal congestion. If due to the vasoconstriction, it can decrease the nasal congestion. Hence these particular drugs that can be preferred, okay, these particular drugs that can be preferred in the treatment of, or these drugs can be used as a nasal decongestant. These drugs particularly used in the treatment of nasal congestion, hence we can call it a nasal decongestants. See, just you can observe here. See, the drugs which can be used for the treatment of shock and hypotension, nothing but, see, the shock and hypotension that can be treated with the help of epinephrine or norepinephrine or dopamine. All are these sympathomimetic drugs. See, sympathomimetic drugs, especially epinephrine, norepinephrine and dopamine, can be preferred to treat the shock and hypotension. How it is happening? Due to the vasoconstriction, especially the alpha-1 receptor located on the peripheral blood vessel. If the drugs that is acting on the nasal blood vessel, same vasoconstriction will be there, and it will decreases the nasal congestion, hence can be used as a nasal decongestant. Can you give the example of the drugs? Nothing but phenylephrine, next oxymetazoline, next 𝘿𝙄𝙎𝙎𝙬. Next one is 𝘿𝙬𝙎𝙎𝙬. So these are the drugs that can be located. See, these are the receptors that can be located in the different part, blood vessel only, but peripheral blood vessel, nasal blood vessel. If it is activation of peripheral blood vessel, the drugs especially in order to treat the shock and hypotension. Here, if the drugs that will act on the nasal blood vessel can be used as a nasal decongestant. The same alpha-1 agonist that can be act on the sphincters, okay, that can be act on the sphincter, where this particular sphincter nothing but urinary sphincter. There is a activation of urinary sphincter will be there. If this urinary sphincter is get activated, so what will happens? Nothing but what will be happens? Nothing but here say constriction. So this is the sphincter. So this is the sphincter. If there is a activation of the sphincter, nothing but constriction of the sphincter, what will be takes place? Nothing but what will happens means here, say the urine that will remain, okay, the urine that will be remain in the, see this is a urinary bladder. See, this is a urinary bladder. The urine that will be remains in the urinary bladder only. See, that is what is the effect we are observing? Urinary retention. Hence, the drug should be contraindicated in benign prostate hyperplasia. Hence, the drug should be contraindicated, especially in the case of benign prostate hyperplasia. Because in the benign prostate hyperplasia, already there is a urinary retention will be there. Hence, if you are giving this, especially sympathomimetic drugs that will all act on the alpha-1 receptor, again it will causes constriction of sphincter, the urinary retention effect will be there. So, alpha-1 agonist drugs can be used in the treatment of shock and hypotension and acts as a nasal decongestants. Along with that, the drug should be contraindicated in benign prostate hyperplasia. Next, alpha-2 drugs. Okay, alpha-2, not alpha-2 drugs, alpha-2 receptor. See, this alpha-2 receptor, it can be located especially on the nasal epithelium, especially the blood vessel of nasal epithelium. Where it is located? The blood vessel of nasal epithelium. What is the role of this one? Nothing but if this alpha-2 receptor will be there on the sorry, not nasal epithelium, here it is ciliary epithelium. Ciliary epithelium, nothing but in the eye. Ciliary epithelium, okay, that contains the blood vessel. If there is a activation of the alpha 2 receptor that is located on the blood vessel of ciliary epithelium, what will happen? Nothing but decreased see here vasoconstriction, same, the vasoconstriction effect will be there. If vasoconstriction will be there, what will happen, sir? Decreased blood flow. The blood flow will be decreased to the particular part of the eye, and a decreased aqueous humor production. A decreased aqueous humor production will be there. Hence, due to the decreased in the aqueous humor production, the drug can be used in the treatment of the condition that is glaucoma. That is alpha 2 agonist. Alpha 2 agonist can be used in the treatment of glaucoma. Next comes to the same alpha 2 receptor. It is located in the central nervous system. It is located in the central nervous system. If it is located in the central nervous system, it will decreases the adrenaline and noradrenaline level. It will decreases the adrenaline and noradrenaline level. Along with that, if there is a decreased adrenaline and noradrenaline, further it will decreases the blood pressure. Further it will reduces the blood pressure. Hence these drugs can be used in the treatment of hypertension. Hence the drug can be used in the treatment of hypertension and glaucoma. See, at the end, alpha 2 agonist, the drugs can be used in the treatment of glaucoma along with the condition of hypertension. When it comes to the glaucomatic drugs, 𝙂𝙀𝙀𝙄𝙎 and brimonidine. 𝙂𝙀𝙀𝙀 and brimonidine. When it comes to the drugs used in the hypertension, that is clonidine and methyl-dopa. Clonidine and methyl-dopa. So this is about the location of the receptors, and if the activation of the receptor, what are the physiological effect and what is the therapeutic use. Okay, if the activation of those particular receptor in the body, what kind of therapeutic use that can be means the therapeutic use of the drugs that can be preferred here.